April 7, 1948, itinatag ang World Health Organization. Ito ay ang espesyal na ahensyang naglalayong tugunan at pamunuan ang buong mundo sa pagharap sa mga pinakamalalaking isyong pangkalusugan. At ngayon ngang may bagong krisis na naman na tumama sa mundo, kritikal ang papel na ginagampanan ng WHO. Mula sa patuloy na pag-aaral at pagde-develop ng mga panlaban sa COVID-19 hanggang sa pagbuo ng mga estratehiya at guidelines para sa kaligtasan ng iba't ibang mga bansa, sinisiguro ng ahensya na sistematiko at tuloy-tuloy ang pagbabahagi ng impormasyon sa mga mamamayan. Kabilang sa mga proyektong ito ay ang launching ng kanilang programa sa pamamagitan ng Facebook Live kung saan sinasagot ng ahensya ang mga tanong ng mamamayan ukol sa COVID-19. Malaking bahagi rin ng nasabing programa ang pagtugon sa ilang mga tanong ukol sa mental health issues na kinaharap ng mga mamamayan sa panahong ito. Paano nga ba kumikilos at nakikipag-ugnayan ang World Health Organization sa ating pamahalaan? At ano pa ang mga ginagawang hakbang ng WHO para tugunan ang hamong dala ng COVID-19?
Dahil sa banta dala ng COVID-19, malaki ang ginagampanan ng World Health Organization upang masiguro ang pamamahala sa global health crisis na ito. Kaya naman upang talakayin ng mga ito, makasama po natin ang WHO Country Representative Dr. Tauhid Islam. Good evening, Dr. Islam.
Good evening.
Before anything else, let's proceed with the current situation of the COVID-19 pandemic. What is the current situation of Southeast Asia on the scale of the global pandemic?
Thank you very much. We all know this global pandemic, the situation globally is almost around 3 million confirmed cases of COVID-19, including around 200,000 deaths reported to WHO. Almost all regions and countries have reported cases, except for some Pacific Island countries and some countries in other regions. In our Western Pacific region, the total cases notified so far is 146,097 cases with 6,011 deaths. Countries and areas across the Western Pacific are at different stage of the pandemic. Some have no cases, others have a limited number of cases, and some have quite large cluster of cases. Some countries seem to be flattening of the curve, while others are seeing the new spike in the cases. A number of countries in the region have annual festivities and religious observations in April and May that normally generate large crowd, and WHO is working very closely with those governments to mitigate those risks. Across the region, we must unite in support of the public health measure needed to stop this transmission. We are all in this together, and we will only get through this together.
Dr. Islam, what is the current status of the pandemic here in the Philippines?
Together with the Department of Health, the World Health Organization is concerned with increasing report of clustering of persons with COVID in densely populated urban areas, especially in public spaces, crowded residential areas, and closed settings such as prisons and health facilities. Everyone is at risk of being infected, most especially the elderly and those with underlying health conditions such as heart disease, hypertension, or diabetes. So we need to protect them the most.
And how does the World Health Organization help in addressing this pandemic across the world?
Thank you. World Health Organization is working very closely with the member states, with all the countries. So World Health Organization works with the countries in many different ways. The first of all, they monitor the situation and they inform the situation to all the member states. Then they actually develop the norms and standard, various guidelines, and they inform all the countries the updated guidelines and guidances. So that's the overall. However, at the country level, WHO works with the member state, with the Department of very closely in the response. WHO helps closely in surveillance and also supporting the government in their ways to respond. In Philippines, WHO is working very closely with Department of Health, and WHO is trying to assist as much as possible the ways that Department of Health and government wants from WHO.
What can you say about the healthcare system here in our region, here in the Philippines?
Healthcare system is obviously very important to respond any health emergencies. And in this case, this pandemic is so beyond the limit that actually even a very strong health system will struggle to adjust or to actually cope with this situation of this pandemic. So I would say that the healthcare system of Philippines is obviously also, if the situation, if the cases continues, the healthcare system will also struggle in Philippines. So what we should emphasize on that how to contain this epidemic at its early stage. We believe that still there is a scope that in Philippines we can contain this epidemic so that the healthcare system will not be overwhelmed or will not be stressed.
Speaking about de-escalating the lockdown of every community, when do you think is the right time to have a modified community quarantine?
That's a very important question. Actually, it will depend on many of the indicators. So WHO suggests all the member states to lift the lockdown in a staged way. And that staged way needs to be carefully planned and carefully thought. It will depend on the epidemiological situation and the capacity of capacity of the response, like the contact tracing and monitoring the non-pharmaceuticals intervention. So we believe that based on those indicators, in a country, the different area may have the different stage of its transmission, and that's why the quarantine can be lifted stage-wise in the different places at different times. So in short, to respond this one, these need to be responded, or these need to be done as per the local situation.
Dr. Islam, there are a number of myths circulating or spreading across the globe on how we can beat COVID-19 and how does WHO address these. For example, the 5G mobile network, it helps in stopping COVID-19. You can answer me if this is true or false.
This is false. Virus cannot travel on radio waves or mobile network. And COVID-19 is spreading in many countries that do not have 5G mobile network. And it is important to know that COVID-19 spread through respiratory droplet. When an infected person coughs, sneezes, or speaks, people can also be infected by touching a contaminated surface and then their eyes, mouth, or nose.
Being able to hold your breath for 10 seconds or more without coughing or feeling discomfort does not mean you are free from COVID-19 or any other lung disease.
Yes, it doesn't mean that you are free from the COVID or any other lung disease. The most common symptom of COVID-19 are dry cough, tiredness, and fever. Some people may develop more severe forms of the disease, such as pneumonia. The best way to confirm if you have the virus is with a laboratory test. You cannot confirm it with this breathing exercise, which can even be dangerous.
Another myth, COVID-19 can be transmitted through mosquito bites.
No, to date, there has been no information nor evidence to suggest that the COVID-19 could be transmitted by mosquitoes.
Spraying alcohol or chlorine all over your body can kill COVID-19.
No. Spraying alcohol or chlorine all over your body will not kill viruses that have already entered your body. Spraying such substance can be harmful to your clothes or mucous membrane, such as eyes, mouth. And we also need to be aware that both alcohol and chlorine can be useful disinfectant surfaces, but they need to be used under appropriate recommendations.
Vaccines against pneumonia can protect you against COVID-19.
No. Vaccine against pneumonia, such as pneumococcal vaccine and Haemophilus influenza type B vaccine, do not provide protection against COVID. The virus is so new and different that it needs its own vaccine. Researchers are trying to develop a vaccine, and WHO is supporting their effort. Although these vaccines are not effective against COVID-19, vaccination against respiratory illness is highly recommended to protect your health.
Rinsing your nose with saline can help prevent infection with COVID-19.
No, there is no evidence that regularly rinsing the nose with saline has protected people from infection with COVID-19.
Antibiotics can be effective in preventing or treating COVID-19.
No, antibiotics do not work against virus. It works against bacteria. So we know that the COVID-19 is a virus, is caused by a virus, and therefore antibiotics should not be used as a means of prevention or treatment. However, if you are hospitalized for severe form of COVID-19, you may receive antibiotic because of bacterial co-infection.
Thank you so much, Dr. Islam, for busting those myths. We have more questions for you when we come back. Marami pa po tayong mga pag-uusapan sa pagbabalik ng Alerto, a COVID-19 special. Nagbabalik po ang Alerto, COVID-19 special, at kasama pa rin po natin si Dr. Tauhid Islam mula sa World Health Organization. Dr. Islam, the WHO has given the Philippines great help in terms of our country's readiness and response operations. The WHO organized its first Facebook Live session to discuss the mental health impact of COVID-19 situation. What is this program? Can you tell us more about this?
Thank you very much. So WHO periodically hosts a live Facebook program to discuss various related topics. And this time, obviously, as you say, that the most relevant topic is COVID-19. And we know that because of various measures needed to be taken, such as the lockdown, the mental health becomes a major concern. The mental health for general people, mental health for the healthcare worker, and mental health for all the communities are very, very important. And that's why WHO organized this Facebook session on the mental health and what should be done to boost the mental health in this pandemic situation. And I'm very glad to say that that was very well accepted by Filipino communities.
What other assistance has the WHO given the Philippines?
Thank you very much. WHO works very closely with the Department of Health of Philippines to fight against this COVID-19 situation. WHO provided various laboratory supplies, also some personal protective equipments, and those what is needed. But WHO is mainly supporting Department of Health in the various technical aspects. WHO is providing their technical support in various policy development and also assisting to analyze the situation. WHO assisted to set up the Emergency Operations Center at the national, and also WHO is willing to support to establish or to strengthen the regional emergency operation center. As I said, that WHO is also with Department of Health assisting in various assessment, such as assessment in crowded situation, assessment in healthcare worker infection, and WHO is also ready and very eager to help in any other technical aspect where Department of Health requests.
Now let's discuss the development of COVID-19. How is COVID-19 different from SARS and MERS-CoV? For it to be declared by the WHO as pandemic, we understand that it is affecting the entire world. But what is the difference between the two that I mentioned?
Right. So coronavirus are a large family of viruses that cause illness ranging from the common cold to more severe disease, such as what you mentioned, that MERS or Middle East Respiratory Syndrome, or SARS, which is Severe Acute Respiratory Syndrome. Now, this one is a new strain. This novel coronavirus is a new strain that has not been previously identified in human. Since 2nd January of 2020, the three level of WHO, mainly the China country office, regional office, and headquarters, have been working together to respond to this outbreak. On 30 January, WHO declared the outbreak as a public health emergency of international concern, and on 11 March 2020, deeply concerned both by the alarming level of the spread and severity, WHO made the assessment that COVID-19 can be characterized as pandemic. So as you said, I mean, this is a very new strain, which obviously there are many unknown, and we all are learning, and WHO is trying to synthesize those all learning so that we can all work against, or we can all work fighting against this COVID-19.
And how is the advancement of technology giving us an advantage in looking for the cure or the vaccine for COVID-19?
The COVID-19 pandemic has already affected more than 3 million people globally, killing more than 200,000 people, unfortunately. So it's taking a huge toll on families, societies, health system, and economies around the world. And for as long as this virus threatens any country, the entire world is at risk. So what would be the solution? And you actually mentioned that how this advancement can help. So vaccination is one of the best ways to prevent the diseases. There is an urgent need. Therefore, while following existing measures to keep people physically distanced and to test and track all contacts of people for COVID-19, the vaccine and drugs would be the most important thing to develop. Until there is either population-wide immunity, effective treatment, or proven vaccine, the virus remains a risk to the people. So currently, WHO is helping to have a big trial on the vaccine, bringing total 6 vaccine candidates to be tested. And we all know that a few months later, we'll see whether a vaccine works in human when early phase studies on its safety and preliminary efficacy in relatively small number of study participants are completed. The challenge is to speed up and harmonize process to ensure that once products are deemed safe and effective, they can be brought to the billions of people in the world who need them. As with all medicine, every vaccine needs to go through extensive and rigorous testing before it is introduced in a country. Once they are in use, they must be continuously monitored to make sure they are safe for the people who receive them. So a large-scale trial will be required to demonstrate statistically and clinically meaningful data to support efficacy and safety for at least 6 months or follow-up studies. Therefore, overall development will or may take 12 to 18 months for a vaccine to become available for the public. However, we know that the vaccine may take much more longer, but due to this importance and due to this pandemic situation, all the parties are trying to expedite the process.
Is there a possibility, Dr. Islam, that we will never find, or our scientists will never find, a vaccine for this?
We should always hope for the best.
My last question, Dr. Islam, what are we looking forward to in terms of international health preparedness and response after this coronavirus or this COVID-19 crisis?
Right. So this crisis actually showed us that we need to be more cautious about the health system overall. And what did I mean by the health system? Because the health system also should have the surveillance component inbuilt, so that we can pick up any of the epidemic at its very early stage. And whenever we identify any epidemic, then we will be able to respond against it. So the future of, after this COVID response, always the intention will be the strengthening the health system, strengthening the surveillance system, and strengthening the international health regulation.
Thank you very much for your time, Dr. Tauhid Islam of the World Health Organization.
Thank you very much.
Isang malaking pagsubok ang kinakaharap ngayon ng ating bansa, pati na rin ng buong mundo dahil sa krisis na dala ng COVID-19. Kaya naman patuloy ang pamahalaan sa pagsasagawa ng mga nararapat at agarang solusyon upang tuluyan na itong masugpo. Ngunit ang lahat ng mga pagsisikap na ito ay maisa sa katuparan kung paiiralin natin ang kooperasyon at pagtutulungan sa bawat isa. Muli po, ako si Secretary Martin Andanar at ito ang Alerto, a COVID-19 Special.